The medical treatment, second to none. It's absolutely superb. And no other county could give what this county's given.
It gives me a way to let off steam sometimes. It helps me understand how my baby's working.
I just think it helps you bond and get closer to your baby and that.
They're a small group of very professional, well-trained and genuinely caring people.
I've had a very good experience, so obviously I can't see any problems from my point of view. Everything I wanted I've got.
The only thing I found was the different district nurses came out with different ideas, perceptions, behaviour.
A patient will say to you, oh, is that better than last time? Well, if you didn't see it last time, you don't know. So there are those sort of frustrations as well, and it's good for patients and for staff to be able to build up a good working relationship. If we've got somebody that's really poorly and wants to stay at home, we can put in that intensive nursing at home for them. We can refer them to other services to provide a tailored care package so that the patient themselves actually knows what's going on.
It gives you that protection, that feeling of, someone's on the ball with you and they're there. And if you want them, they'll be there. That has been a godsend, and if that were taken away, I don't know I'd be back in hospital.
I mean, as a minor criticism, I'd say that I'd like them to come more often.
If a patient deteriorates and needs a high level of care input, then obviously it goes out to whoever can provide the care.
It's a hard thing for the patients and the families, if they have got used to a team of carers, to then have another team of carers come in at a very vulnerable time of their life.
In palliative care, continuity is very important to both the patients and the carers.
You have to find out everything for yourself. There's no one tells you who to ask or what help there is. You have to find it.
There is a lack of awareness of what community services are out there from both a patient level and a staff level in the acute trust.
In an ideal world, I'd have numbers I could phone and people would come within half a day or a day or so.
I want more integration between health and social care, between the community teams that are out there, a better understanding of what everyone does and what we do, more patient contact time and less barriers to accessing specialist equipment.
Well, after I had my baby, and I said to my health visitor and that there wasn't enough actual groups for other parents to go to who went through their pregnancies together.
Being a teenage mum is a huge vulnerable factor in itself, isn't it? Lots of challenges that people face here, obviously, with employment and the economy, and lots of intergenerational patterns forming.
It would be better if the frontline staff had the freedom and power to sort of make the changes that we need to make it better for the patients.
Our transformation is based on 3 areas. Clustering of the teams will bring clinicians of different professions together to work around a population, understand the needs of that population and manage their needs more effectively. The 24/7 nursing will allow us to see patients during the twilight and early hours. We will increase the services during those times and reduce admissions as a result of that. With mobile working solutions, patient records can be completed with the patient in the patient's home. We can prevent the number of journeys we have to do backwards and forwards to base, and therefore we can increase our capacity.
We're going to go out and talk to people in the community, find out what it is they want, where they want it and when they want it, and then provide those services so that they can actually use them.
The Community Health Project is an innovative and exciting way which allows us to work with parish councils and members of the community and also other medical professionals. It's an amazing opportunity and people really enjoy their experiences at the hub.
The main thing it's all about is working in partnership, working alongside each other, understanding how each other works and being approachable to actually help each other out.
It's important that we get the chance to integrate healthcare with single points of referral and multi-access to services.
We are committed to delivering high quality care every time. We believe the way to do that is to recruit high quality staff and give them the best environments in which to work.
We have approaching 700 social entrepreneurs out there ready to improve the services for the people of Great Yarmouth and Waveney. We need to tap that potential to achieve cost improvements and at the same time improve the quality of the service that we deliver to people.
We have a real sense of ownership, empowerment and a renewed focus on making sure that we deliver the needs of our patients and service users both now and into the future.
We believe the health and well-being of our population will be met through collaboration of our staff, the patients and our community.
We do this by understanding our patients and communities better than anyone.
We do this through mutual ownership of our business through all our staff.
By relentlessly striving for improvement.
We will be professional.
We will be knowledgeable.
Trustworthy.
Committed.
Accountable.
And collaborative.
Approachable.
Flexible.
Reasonable.
Compassionate.
The family nurse partnership to me means something where I can actually see it makes a difference to a child's life. Absolutely amazing.
Time spent with the patient is what the job's all about.